Okay, so we're going to talk about the pancreas now, and I want to go back to talking about what does the pancreas do. And you guys can see here that the function is that it produces enzymes, and we talked about the names of those enzymes already, right? So if you want to go ahead and write those down, it's lipase and amylase. Lipase and amylase, okay? And what those enzymes do is they break down not only fats, they can break down fats a little bit, but they're also going to break down basically anything, also starches and proteins. So those carbs, proteins, and fats, basically pancreatic enzymes will chemically break down all the foods that we eat, right? So anytime that we have food that goes from our stomach into the intestine, pancreatic enzymes are triggered to be released through that common bile duct into the intestine for the purpose of mechanically just chewing through that and breaking it down, right? And so that's what happens. And so that's really important for you guys to understand. Now, there's a lot of different pancreatic enzymes. The ones that we tend to track most commonly related to pancreatitis is going to be lipase and amylase, but you might find that others might be tracked also. And certainly it's important to know that there are many pancreatic enzymes. Now, we know the pancreas doesn't just release pancreatic enzymes. It also produces hormones that regulate our blood sugar. And those hormones are going to be insulin and glucagon. So write down insulin and glucagon there. And those are going to be conversations for a different day where we're going to talk about diabetes, when those hormones are not properly produced or released by the pancreas. And so we'll get into that in the future. For now, though, let's just think. What might be affected if the pancreas is inflamed and angry? We might not have good regulation of blood sugar. So just kind of high level right now, recognize that that is a function and that blood sugar may be and likely will be affected for a patient who has pancreatitis. Okay, but I really think it's important for you guys to know that anytime that there's anything in the stomach moving into the intestines, the pancreas is going to be triggered in order to release those pancreatic enzymes. That's really important. So what is pancreatitis then over here? Well, it's an itis, which means, duh, it's an inflammation of that organ. It's inflammation of that pancreas. And just like the other disorders that we've talked about, it can progress to infection, so sepsis, right? And septal shock from there. So important to understand that this is a condition that we as nurses want to know how to recognize the key signs. And if we have a patient experiencing pancreatitis and we're treating them for it, we need to make sure that we're following the treatment plan and assessing for those worsening symptoms that may indicate that we've moved into infection, sepsis, and shock, just like all the other things that we've talked about, right? Okay, but really, pancreatitis is inflammation of the pancreas. And the most important thing that we want to do is we want to be able to rest this inflamed and angry organ so that it doesn't have to release those pancreatic enzymes. And the only way to do that is going to be to keep the stomach super, 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 super empty. So if we keep the stomach empty, then we don't have any food or fluid coming past and triggering that pancreatic enzyme release so that the pancreas can have a nice rest and heal up, and while we do other supportive measures, which is fantastic. So just kind of thinking about what the pancreas does and how that all feeds in for a patient who has pancreatitis. All right, moving on down then. So what causes it? Really two things, okay? The first one that is very, very common is going to be chronic alcohol use or abuse. And this is not, I had a glass of wine and that probably caused pancreatitis. That's not what we're talking about here. We're talking about either one excessive event of alcohol consumption, or what's most common is going to be chronic abuse and long-term abuse of alcohol. That is a very, very common cause of pancreatitis. Another very common cause is going to be gallstones. And you can see here, I pretended to make a nice red big stone in that common bile duct. And so if that stone is in the common bile duct, think pancreatic enzymes are not going to be able to travel through that to the intestine. And then, well, of course, we're going to get a backup in irritation and inflammation of the pancreas. So two real common causes. And so you can imagine that anybody with pancreatitis is going to have to go for imaging in order to assess, either rule in or rule out that the patient does indeed have gallstones or doesn't have gallstones, and then that causation is otherwise. So 2 main causes of pancreatitis: chronic alcohol use and gallstones. And don't forget that fancy terminology for gallstones, right? Chole means gallbladder, lith means stone, right? So cholelithiasis. So what does pancreatitis look like? Well, the pain is very specific. Just like when we talked about with the gallbladder, the pain from that is a very specific area and happens related to very specific causes. Here with the pancreas, pain is going to be in the left upper quadrant and the right upper quadrant. And you're saying, Christy, you said right upper quadrant with these organs. Well, of course, the pancreas lives in the right upper quadrant, but it's a long organ, and a little of it does trail over into the left upper quadrant. We do notice that your patients will really have that upper abdominal pain for sure. What does it do? It worsens when your patient eats or drinks, and they eat or drink anything. And this is what's important, right? Gallbladder is going to flare up because you made it actually turn on and start working when you eat fats, right? But what makes your pancreas have to turn on and do work? Eating anything, right? Fats or carbs, starches, or those proteins. So basically, eating or drinking anything is going to cause those pancreatic enzymes to actually need to be released, and you're continuing to make that pancreas work. An angry pancreas does not want to work, right? So that pain worsens anytime you stimulate that pancreas to release more of those enzymes. So eating or drinking anything is going to cause that pain to worsen. The other characteristic about pancreatic pain is going to be that it radiates to the back. So remember, where did the gallbladder radiate its pain? To the right shoulder. But the pancreas, for pancreatitis, will actually, they call it boring pain. And believe me, it's not boring. It is intense, severe, excruciating pain. Patients will really be struggling, okay? But it bores, meaning it feels like it goes through from the front of their abdomen all the way through to the back, like it's boring a hole, is that kind of how that pain feels, like it's going straight through the patient. So if you say, describe boring pain like it's going from your abdomen straight through to your back, patients will really relate to that oftentimes and say, yes, that's the pain I'm experiencing. Something else, so that's going to be the pain, right? And you should maybe pause the video here and see, can you express the type of pain that a patient with pancreatitis will likely complain of? Complain's a bad word, describe, right? Complain implies that they're irritating us. I just don't like to use that word with pain, and I wish I hadn't. But anyway, and then can you differentiate gallbladder related pain from pancreatic related pain? So pause and do that. And if you're unpausing, that means you're coming back to me to talk about more signs and symptoms of pancreatitis. So this weird gray-blue discoloration of the abdomen and the flanks. So starting on the abdomen and going around the sides and kind of toward the back of the patient, you'll notice that those pancreatic enzymes can cause that gray or blue discoloration. It won't be on every patient, but if you ever see that and your patient has pancreatitis, it doesn't mean anything is crazy. It's just it's another sign of those crazy elevated pancreatic enzymes that does cause that discoloration. Of course, a patient with pancreatitis would have fever, that low-grade fever, to which we say duh. And I say that because anything that ends in an itis, right, could, because of that inflammatory process, cause fever, low-grade fever, elevated white blood cell count, right? We know that that's what the inflammatory process in our bodies does. Okay, so any itis, you're automatically going to know low-grade fever, elevated whites, right? Definitely can be there. What you're going to notice also is that I've turned everything here yellow, because guess what? When your patient has pancreatitis, surely all of these things can turn yellow, starting with just generalized jaundice. So jaundice can just be a yellowing hue to the skin. Depending on the skin tone, you may or may not be able to notice that as well. Where we definitely can, on any skin tone, notice jaundice and assess for jaundice, especially on those darker skin tones. Look at the sclera of the eyes. That white area of the eye, the sclera, is a great place to track for jaundice. Then we look at the stool, that clay-colored stool, because stool turns yellow, right? And then the urine will be dark, and oftentimes we talk about it being a straw color. So a dark straw-colored urine, really everything turns yellow. Why is that happening? It's because this patient oftentimes is going to remember all three of these organs are connected, and this patient is often going to have bilirubin trapped in the body and an excess of bilirubin. That's what turns everything yellow. They're also going to have this lovely thing called steatorrhea. We learned about this before, right? Steatorrhea is very simply fatty stool. I should have given you guys a chance to say that. You knew that, right? And I've included the picture here again, that light-colored, frothy, foul-smelling stool that you're seeing there. And remember, not only does the gallbladder release bile in order to break down fat, but also the pancreas does release pancreatic enzymes, which do have some role in kind of a secondary role in helping to break down those fats. So they're not as effective in doing it, but basically if the pancreas isn't doing its job, we still are not breaking down as much fats as we would if the pancreas was working at full throttle. And so we will note steatorrhea can happen with those patients who have pancreatitis. Awesome. Okay. So what labs are we going to see? The first very classic change you're going to see with pancreatitis with labs, and you have to track these and you have to care about these, is going to be the pancreatic enzymes, okay? And the most common that we track is going to be lipase and amylase, right? The two southern sisters. They will be elevated so high that they're 3 times normal or maybe even higher than that. So the numbers just seem astronomical when you look at them compared to normal range, okay? And a great way to track how well pancreatitis is resolving is to, as we do retest those, and I'm noticing they're retesting them on a slower schedule because they don't move down fast, right? But when they are run in the labs, we're going to watch for them to be trending down. And something that is a fun thing to share with your patients when you're checking in on them, and you checked and you saw, okay, yeah, we ran the pancreatic enzymes. Let's share those results with the patients that we're noticing that the numbers are coming down, and that's a sign of positive movement. When they're still experiencing pain, it's nice for them to get some kind of message that there's positive change happening, right? Things are looking up and getting better. So we track those. Make sure that you guys are constantly, if you're taking care of a patient with pancreatitis, look, that southern pancreatitis, you should be tracking lipase and amylase, okay? All right. Also, the white blood cells are going to be elevated. We already talked about this, right? To which we say duh. And we said duh because pancreatitis is an itis. It ends in itis, which means it's an inflammatory condition, which means our white blood cells and low-grade fever is always going to be happening with those. All right. Now, whites getting higher and higher and higher and continuing to trend up might be a sign of developing infection, right? So we don't want to ignore whites being high for a patient who has pancreatitis, right? We don't want this to turn into an infectious process, which can then become sepsis and septic shock. So we watch them, but if we notice that they're a little high, it's kind of like expected, let's watch it kind of a thing. Blood glucose can be elevated. Wait, why? And I'm waiting here because I really want you to think this through. For a problem with the pancreas, why are we thinking that blood glucose could be high? And I hope you're saying because one of the jobs of the pancreas is to regulate blood sugar with the hormones that it produces, which is insulin and glucagon. You're absolutely right, okay? So just keeping an eye on that patient's blood sugar through their labs is also just a very smart thing to do. And if needs to be treated, can treat. And so that's just patient specific. All right. And then serum calcium. This is the one that people like to forget about when it comes to pancreatitis. Because remember one of your pancreatic enzymes was lipase. Well, do you remember that I said sometimes you might have that evil sibling? Well, lipase is the evil sibling of those sweet southern sisters, okay? High lipase actually binds up calcium and makes it unusable. So the higher your lipase levels are with your patient, the less usable calcium they have. And guess what? They're going to have all those signs and symptoms. I know, cover your head. I know you're stressed already, of hypocalcemia. Fluid electrolytes. No, but it's true. Everything comes back to fluid electrolytes. So as those pancreatic enzymes go high, specifically that evil southern sister lipase, okay, the higher lipase levels are, potentially the lower that your calcium levels can be, because lipase likes to bind calcium and basically make it temporarily unusable and not functional. So you will have the full set of symptoms of hypocalcemia sometimes with that patient. So what am I going to screen my patient for who has pancreatitis? What about having that tingling kind of or numb sensation around the mouth